Dry needling, also known as trigger point dry needling, is a skilled intervention using a thin filiform needle to penetrate the skin and stimulate underlying myofascial trigger points and muscular and connective tissues for the management of neuromusculoskeletal pain and movement impairments. The needle allows a physical therapist to target tissues that are not manually palpable. Dry needling is practiced by physical therapists in many countries including Canada, Chile, Ireland, the Netherlands, South Africa, Spain, Switzerland and UK. In the United States, the American Physical Therapy Association and the American Academy of Orthopedic Manual Physical Therapists have ruled dry needling to be under the scope of physical therapy practice. The technique is performed using a dry needle, meaning there is no medication inserted through the skin into areas of the muscle used during treatment. A thin, sterile needle is inserted into the skin into areas of the muscle known as trigger points. Muscles sometimes develop knotted areas called trigger points. These trigger points are highly sensitive and can be painful when touched. They are also often the cause of referred pain or pain that affects another part of the body. As the needle enters the trigger point, it releases the knot. This release helps to increase range of motion and improve or decrease pain. Dry needling is not acupuncture, a practice based on traditional Chinese medicine and performed by acupuncturists. Dry needling is a part of modern Western medicine principles and supported by research. Preliminary research supports that dry needling improves pain control, reduces muscle tension, and normalizes dysfunctions of the motor end plates, the sites at which nerve impulses are transmitted to muscles. This can help speed up the patient's return to active rehabilitation. That's why this method is often used to treat sports injuries, muscle pain, and even fibromyalgia pain. Dry needling is almost always used as a part of an overall plan that will likely include some type of exercise, manual therapy, heat therapy, and education. Dry needling is used to increase range of motion that may be limited due to muscle tightness or scar tissue. Dry needling may also treat joint and lower back pain, tendinitis, migraine and tension-type headaches, jaw problems such as temporomandibular joint disorders, repetitive motion disorders like lateral epicondylitis and carpal tunnel syndrome, pelvic pain, night cramps, phantom pain, and spasticity as a result of stroke. In and out techniques. Some forms of dry needling use techniques called pistoning or sparrow packing. Both of these techniques rely on in and out needle insertion. In other words, the needles don't stay inserted in the skin for long. The needles prick the trigger points and are then removed. Non-trigger point technique. Some dry needling techniques treat a broader landscape of the central nervous system. This is called non-trigger point treatment. Instead of inserting needles only in the area of pain, the practitioner may instead insert needles in areas around the point of pain instead of directly on it. This technique relies on the idea that pain is the result of a greater nerve or muscular issue, not just focused in the main area of pain. The needles may be placed deeply or superficially, for shorter or longer periods of time, depending on what type of pain is being treated and how long it has lasted. Shorter periods of time would mean that needle would stay in the muscle for seconds, while longer periods could mean 10 to 15 minutes. The length of time depends on the practitioner. A patient may experience different sensations when being needled. Muscle soreness, aching, and a muscle twitch when a needle is inserted is considered to be a good sign. Most adverse effects have been minor and include soreness during or after the treatment, bleeding at the place where the needle was pushed in, and bruising. Dry needling is one of various treatment options that might be part of your care when you see a physical therapist. Any patient who is considering dry needling should consult his or her doctor first. This is particularly true for people taking blood thinners and people who are only recently recovering from surgery.